Hi, staff. Okay, so this is the portion of the staff meeting that I am going to go through that George did such an amazing job that I just wanted him to be able to complete um, what he was covering, and we're just so grateful for his expertise and willingness, and that was great. So, because it's a video and not a meeting, I'm going to try to just go super quick, super straightforward. So, just know anything can be followed up with me in regards to questions or anything. If you see me looking to the right, I'm just looking at my papers. So, okay, Tuesday, July 5th, we will be having Kevin, who is our newest tech, join the team. He will be at North on that Tuesday, just to be able to get a feel for the North crew and just kind of the flow of how things are going. And Kylie and Alfonso will be tag teaming, training him depending on who's down south. So he will only be at the North on Tuesday, and then he will be training down south. And we're just going to take it a week at a time and see how he does by the end of the week. But he will be formally at our south location, and he's going to be a great addition. So looking forward to having him. Front desk interviewing is still happening, and so that's still in process. Okay, so here are some of my bullet points. We have the majority of our PT and PTA schedules parallel. We have a little bit of a difference now with Sarah, who has 1 hour at the end of the day, one day that she is there without a PT. And so in that case, and if that case comes up any other times, it is probably more valuable for her to be able to utilize the tech first and then do her treatment afterward, because she can't utilize the tech when the PTs leave. So if that's conducive for treatment, that would be best for those kind of scenarios. But the other thing is that no PT should be leaving early, especially when there's a PTA working with a patient. Because when that happens, then the aide is not able to help and do any support care whatsoever. And so in order to avoid that circumstance, let's try to do the best we can to redistribute patients where we can. And again, and if it's a unique situation or something, then it's perfectly fine. But if you just happen to have a couple cancels and, you just want to cut out early, then I'd prefer for us to be able to stay on site, redistribute patients, see if there's needs any help anywhere else, especially even checking in. Like, you might be perfectly up to date with your notes, but like checking in with somebody else, like, hey, do you need a little bit extra documentation time? Just kind of use the teamwork approach in that case. That's what we would expect. So another piece that I wanted to talk about is decreasing our cancellation rate. I do want to kind of hear from you guys in terms of if we are still using these cards, if we never really got lifted off in using these cards. I think this would be helpful in regards to giving the patients this after the eval. And then for the providers, just to keep pushing the importance of patients coming to their appointments. And we know classically patients listen to us as clinicians more than the front, which is no negativity on them. It's just we have the authority over their care, and so they seem to respect that a little bit more. One of the things that we have run in terms of statistics is some local versus dynamic PT cancel and no-show reports. So what we have found is that so at the North office, one of the lower ends of the cancel no-show report would be 14.3%. The higher end is 22.2%. North office, we're at 22.3%, which means we're pretty high up there on the cancellation report. South office, lowest is 14.3%, and the highest is 25.4%, and the South office is at 29.2%. So we know there's different demographics and we know there's different factors, but we really do want to be able to really minimize and decrease that no-show cancellation report, especially because those numbers are being compared to local other cancellations. Another piece of data that we were also able to determine was the number of visits per discharge, which I think is just valuable information. Local productivity versus dynamic. And so the lowest is 11.2, highest is 19.4. North office is at about 12.6 visits per DC, and the South office is at 9.8 visits per DC. So we obviously don't want patients here forever. That's not our goal, but we do want to be able to make sure we're maximizing their time here and that they're getting full treatment, recognizing the importance of PT, recognizing the value in completing their full plan of care. And that's just something that comes from us. We need to be leading that and reinforcing, hey, maybe we don't want to get them back to just being safe walking alone, but maybe being able to get back to, negotiating stairs the 1 or 2 times a month that they go to the mall or something, something that is a little bit more than what would just be basic. Okay, another point is if you spend an hour with a patient, don't forget to put that fourth code. Whereas there's absolutely lots of valid reasons to be able to do the 4 codes. And I just noticed that sometimes we just use the same codes from the previous visit and don't add the extra code if there's extra time spent in the treatment. Another piece with that is if your patient wants to leave early, obviously there are circumstances where that is reasonable, but if they're just kind of like, I'm kind of tired, then just be creative with how you're filling that treatment time and making sure that we're giving them the maximum benefit of them taking their time to be there. Sometimes we have to be the advocate for that. Sometimes people are, less than thrilled, or they're just checking a box. And so just be creative. And if you have a hard time with the creativity in their treatments, please ask colleagues, ask me in regards to what else can be done if you're having a hard time filling the time. Each patient's different, but especially for some of the newer therapists, I think it's always valuable to be able to just bounce ideas off of others. For pool patients, if there is a cancellation on the schedule, please make sure you're working with the patient for an hour if that is tolerable to them and if that is valuable for them and their treatment. Obviously, we'll let them know that it's not normal and they got an hour because of the cancellation, but that is something that is super valuable and important to be able to maximize the time that they are there when we can. I think that was kind of it. I think overall, just, we really just all need to work together in order to decrease the cancellation and no-show rate, just with where our numbers kind of fall with some of the local averages. And you guys are all doing such a great job. These are the fine-tuned details of things that I have to reinforce, but yet, you're all doing a great job. So just know that. Another data point that I did touch on was the number of units per provider per visit. Again, for the hour treatments, we should be trying to do 4 units as much as possible. And obviously we know different circumstances call for different things. But I would say the majority of the averages are pretty good. Audrey's and I are a little bit lower because we have 40-minute treatments, but overall it's pretty good. So what I would suggest is that just reach out to me if you have a question about your specific one. I don't want to share everybody's just like a blanket statement on, on a forum like this. But there are a few of you that could use some room for improvement. So if you're interested in your exact number, I would love to be able to pass that along to you. And another topic that I wanted to be able to touch base, and this is kind of more of a discussion, but if anybody has any feedback or thoughts in regards to this, this is mainly for North office, but also, South, I think you guys are pretty good on space. I know you can get tight at times depending on the day. So I guess my first question would be, how is South doing with space? How's everything feeling right now with the dynamic of how things are? The only thing that'll be changing for you guys is that Kevin will be there instead of Marissa once he's all trained. But North, how do you guys feel like the space is in the gym area? We are more than open to ideas, outside the box ideas in regards to potentially using the downstairs treatment area. I treated there for several years, and it's a great area for treatment. There's a lot of value with that area. It would be just a little bit more spacious. Just kind of open to some feedback in regards to if anybody has any thoughts or ideas, how we could use that space well. Yeah, I think that was, and then the only last thing that I wanted to touch base on were the mentoring blocks. I love that we're adding this into the mix. I love that this is something that can be really valuable for just cohesiveness and just everybody's growth. It's great to learn. It's great to lead. It's great to be able to, be on both sides of it, honestly. So embrace them for what they are and let me know if you have any questions about them. I would like just like a little, even if it's just like a line or two, snippet from those blocks after you complete them. That would just be helpful just to know what was covered and kind of the take homes of it. That'd be great. And we will most likely be putting them on Wednesdays because that seems to be a slower day for us. But I'm also going to be trying to run some analytics on amount of patients per day to give us more information in that realm for different reasons. And as of now, though, what we know from the past was that Wednesday was our slower day. So that's where those blocks will be going. You guys are all wonderful. Grateful for you all. Looking forward to seeing whoever is going to be able to make it to the gathering on Friday. And hope you all had a wonderful 4th of July weekend because you'll probably be seeing this once you come back to work on Tuesday. Take care.